Good day. I'm Pamela Arora, and I'm the CEO President of AAMI. And today we're here at HIMSS as HIMSS is starting to pack up. It's the last day of the conference. I am so pleased to have with us Elena, Sini, and Susan Heichert. They are the incoming chair and vice chair of the global board for HIMSS. It's very kind for them to give us some time today, but I'm going to have each of them introduce themselves, and then we'll go from there with just a little bit of discussion. Elena?
Thanks, Pamela, for having us here with you today. As you said, my name is Elena Sini. I'm Italian. I live in Milan, and my background is an engineer, telecommunication, electronic engineer. Then since 2000, I have been working in healthcare. So I have been the CEO of the Italian healthcare facilities, 10 years in the public sector, and I'm almost done 10 years now in the private sector as well.
Well, HIMSS is very fortunate to have you as the incoming chair. It's wonderful.
I am so unfortunate, actually.
We're very excited.
Susan,
I'm Susan
please.
Heichert. Thank you, Pamela, again for having us here. HIMSS it's been a great week at HIMSS. We've been so excited about seeing everybody again and just all the great conversations that we're having here. I know some of our AAMI comrades are here as well, so that's great. My background, I am actually a nurse by background, but in I even hate to say it, 1980s, I got pulled into the tech side. So I've been fortunate to be able to grow up with all this tech. My last job in healthcare was as CIO at Elena Health in Minnesota, which is where I live, which is in the US if we have an international audience.
Absolutely.
And now I do consulting, independent consulting in the healthcare IT space.
Yeah, very good. That background, that mixture is fabulous. The theme of the conference here has been health that connects, tech that cares. And I thought you might want to comment on that, Susan, as far as what you've seen throughout the week. It's been fabulous.
Yeah, I think we've had a real highlight on artificial intelligence, machine learning, large language models at this conference. And, as you look towards the future and what that's really going to mean from a healthcare perspective, we're looking to really augment the decisions that our caregivers make so that our outcomes for the patient improve. And that can happen on so many levels from a technological standpoint. It's not just directly at the bedside, but it's, every piece of information that we're getting from every device that feeds into that record and, taking all of that information that one single person could not possibly process and really using our tech to leverage it so that we can have the best conversations we can have with patients, take care of them in the best way that we know how, and then hopefully minimize any acute care hospitalizations and get them back to the places where they want to be. So from what I've seen on the show floor this week, the conversations that I've had with people, everyone is very aligned about healthcare. That comes first. Tech that cares, okay, maybe that sounds a little bit, how can technology care? But when you put them all together, it's the equation. It's the 1 + 1 = 3. That's what makes the difference.
It's a universal need, and it's so exciting. There's been a lot of themes around equity as well.
Yes.
But when we look at the AAMI stakeholders, they really look at that global harmonization because we can learn from each other the best practices, but it's just efficient when you have something that works, that it's used in a universal way. When we kind of look at the globalization, I think your background is wonderful as far as helping to build those bridges. Did you want to make any comments around where HIMSS is going with that and where Europe's going?
Yeah, actually, this is an exciting time in Europe. But after the pandemic, there are all the European countries have the possibility to really invest in health IT, and this hasn't been this way, the last few years. So now with the recovery funds, each country has to define some digital health strategy, and this is happening, and we actually have to deliver within the next few years. But the most important initiatives is and we discussed a lot about that here during this conference, because as you said, this is the only, I think, safe space where people really connect and share and learn from each other. So we talked about the European Health Data Space, which would be the opportunity for European citizens not only to improve research, innovation, really enable, the data we have in order to advance the care we deliver, but at the same time, continuity of care for our own patients, not only within our own countries, but through the European countries. And so this is a huge goal, critical for sure, but at the same time brings on interoperability, which is, the way we can rely on data, not only from the classic information systems, but also from all the
Medical
the
devices.
medical device world, sharing data, relying on international standards, which are already there, but setting in place a data governance at the European level, which is, our goal, the goal we should have had for so many years, and Europe is so committed. So for Europeans like myself, being here today and having had this amazing week, because I had so many positive comments, people were so thrilled to be here, to be back, having the opportunity to understand what's happening in other countries, what US is doing on these topics, because they're so relevant for all of us. Anyway, great opportunity to learn and share, and the global community of HIMSS brings together once a year. It's an event. It's more than just an event. It's just our global communities together, working together and learning from each other. So for us, it's an honor to serve on the HIMSS board. But I'm hearing from all the members and attendees that everybody's so really thankful for this opportunity. So
Well, I am going to say that HIMSS is in very capable hands with you two ladies. And I will say it's an inspiration to many women out there as far as your leadership. But I look forward to the future. I think it's bright. Thank you so much.
Thank you
Pamela.
so much. Appreciate it.
Thank you.